I want to now talk to you a little bit about tonsillectomies and what would a parent expect for their child after they undergo an adenotonsillectomy. When a tonsillectomy is being done for obstructive breathing, we always have to consider the fact that a child may have very significant sleep apnea. And if a child has severe sleep apnea, then that child should probably not be sent home after a tonsillectomy. They may need to be observed overnight for observation in the hospital-like setting, monitored, to make sure that you don't experience obstructions, and give a child with this condition a narcotic for pain that may exacerbate obstructions. So that is going to be our first line of concern in a child who undergoes an adenotonsillectomy. Make sure that proper monitoring is provided postoperatively, especially in the setting of severe sleep apnea. More milder forms of sleep apnea or recurrent infections are often managed very well in the outpatient setting, so not all children need to stay the night. I would propose that children under the age of 3 be considered for overnight observation. This population tends to not only experience slightly more obstructions in the postoperative setting, but they also may experience a refusal to drink and are going to be slightly more prone to becoming dehydrated. The biggest concern after a tonsillectomy that we have is discomfort. And discomfort can be significant after a tonsillectomy, and I'm sure many people have known somebody who's gone through this procedure or may have gone through the procedure themselves. And how we treat and manage the discomfort is very important. There are many things we can offer a child. We can offer medications like Motrin or Tylenol. Some people offer narcotics like Lortab or Tylenol with codeine, although there's some concern about the effects of these medications on children postoperatively, and there might be some risk associated with those medications. Some physicians, and I like to offer a lollipop with some numbing medicine on it. For some children, that becomes very useful, and it limits the amount of narcotic-like medication that a child might need. With proper control of the discomfort, the experience becomes so much more tolerable for the family, and it's not as stressful for the child as one would expect. Another significant concern about a tonsillectomy is the potential for postoperative bleeding. Bleeding is a condition that happens between 1% and 4% of children after a tonsillectomy. It happens a little more frequently in children who are older than children who are younger, but regardless, it's of serious concern. And the period of risk is a period of approximately 2 weeks. So during the 2-week period after a tonsillectomy, I would often urge my patients to not go on a vacation and be away from a facility that would be able to manage the rare incidence of a postoperative tonsil bleed. Finally, it's very important that families understand that dehydration can happen at any time in the 2-week period after tonsillectomy, but it certainly is more likely to happen immediately in the first 3 or 4 days afterwards. So encouraging a child to drink is going to be of paramount importance in this management. In the end, a tonsillectomy provides many benefits to obstructive breathing, and this happens over 3 to 4 weeks often, not right away. Sometimes the swelling after surgery leads to some obstructions that cause the sleep apnea to still be present in this immediate postoperative period. But then interestingly, after the child experiences a decrease in swelling and a tightening that comes from the scarring associated with this operation, the airway stiffens and the breathing improves significantly.